All right. We're going to go ahead and get started. Don't want to delay any longer. Good afternoon. My name is Elliot Williams, and I'm the training manager at the National Press Club Journalism Institute. Thank you for spending your time with us this Tuesday. Just a few notes before we begin. We are recording this program, and to create a safe space, we ask that you disable any third-party AI assistants that may be recording this session, and we'll disable any that we see in the chat just so you're aware. We do want to remind you that closed captioning is available in the navigation tool at the bottom of your screens, and highlights will appear on our website and in our daily newsletter for journalists, which you can subscribe to using the link in the chat. And we will share with all registrants the recording as well. But before I get too far ahead, let me introduce our wonderful guest speaker. Katie O'Connor is a senior staff writer for Psychiatric News, where she covers mental health policy and research. Previously, she reported on health and social services with the Virginia Mercury and the Richmond Times-Dispatch. She has received fellowships and awards for her long-form investigative reporting from the Virginia Press Association and the Association of Healthcare Journalists. Katie has been gracious enough to spend her time with us today and will share practical guidance on how to cover mental health from the population perspective, and she'll also share tips for finding sources, stories, and data while addressing misinformation and stigma in the mental health coverage arena. Throughout the program, please submit your questions using the Q&A feature in the menu at the bottom of your screen. This feature allows you to ask questions anonymously if you so choose, and approved questions will appear for everyone. Of course, we ask that you remain respectful of others in this group and the time that we're sharing this afternoon. And as we get started, please let us know where you're tuning in from in the chat. We love to see where everyone is joining us from. And with that, I'll give the floor over to you, Katie. Thank you.
Great. Thank you so much, Elliot. I really appreciate it. It's really an honor to be here to essentially nerd out over something I've spent so much time covering. And I'm excited that so many people are interested in writing about this topic. I'm not used to talking for 20 to 30 minutes, so we'll see how I fill that time out. But I do also get really excited about this stuff, so I might end up talking a lot. So let me go ahead and share my screen. We have a few slides here. So when we're talking about public mental health, what we're talking about is something that addresses mental health from a population perspective, especially focusing on prevention. As a reporter, I think of it pretty broadly because, as I'll explain in my presentation, reporting on public mental health inevitably leads us into reporting on a lot of other issues and systems as well. But you can find a lot of stories to cover in this field. I would argue that it gets left out of national conversations quite a bit. And so taking the public mental health angle can give you a fresh way to approach a popular topic. So arguably, all of the biggest social issues we are dealing with right now are public mental health issues. They're just not always framed through that lens. Anything related to AI or social media, substance use, the legalization of cannabis, the increased use of methamphetamine, those are all public mental health issues. But think of other big topics. The economy. Poverty is a huge driver of poor mental health outcomes. Stressors like not being able to afford childcare or not being able to fill your car with gas. Climate change, mass incarceration, housing issues, homelessness. These are all public mental health problems. And you'll find public mental health programs can take place everywhere, basically anywhere. They're in schools, they're in facilities for the elderly, they're in hospitals and churches, in certified community behavioral health clinics, in jails and prisons, through local peer programs. It's a reflection of the fact that public mental health touches a lot of different sectors of our society. I'm going to use one of the biggest investigative series I did when I was in Richmond as an example. It started by looking into a lot of pedestrian fatalities that were occurring at a local intersection. Residents of an assisted living facility were getting hit by cars. So I was trying to understand why these residents were panhandling, even though they were getting state funds to stay there, which got me really involved in the state social services system. And then come to find out that about 90% of the people who lived there had serious mental health conditions. As the situation evolved, there were, I think, at least 2 deaths by suicide among the residents there as well. Now, that story ended up with the state getting involved, and the administrator of that facility got arrested. But for me, the story kept going. It turned into a homelessness story because some of the residents were getting kicked out and were living behind a nearby Walmart. And then that turned into a criminal justice story because one of those residents who lost access to his schizophrenia medication ended up in jail. And from there, we went to a supportive housing story because his parents had to help him figure out where he could go and jump through the hoops for him to get there. Honestly, that trajectory for a story is not unusual when you're covering mental health. Unfortunately, even though mental illnesses are treatable, a lot of people don't get treatment or face too many obstacles to treatment, and they end up entangled in systems they really would rather avoid. Now, I share all that just to emphasize that there are almost certainly issues like this in your community or in your state, and you can do a lot of valuable work with your reporting by digging into them. Our mental health system is pretty chronically underfunded. There are a lot of vulnerable people who are struggling as a result, and there are also a lot of people doing really good work to help. So there are truly many human stories here to cover. So when you're approaching a topic, look upstream. How did an assisted living facility end up essentially warehousing people with mental health conditions? And then also look downstream. How many other people have ended up homeless despite qualifying for state support because of poor management by assisted living facilities? So, experts often refer to a mental health care continuum, and it helps to sort of frame this by looking at it that way. It starts with promotion to improve mental health, then moves to prevention to stop the development of poor mental health, then leads to treatment, and finally, recovery. The healthcare system and insurance mostly focus on treatment. They will pay for some early prevention too, but that's not as common, and acute treatment is really their focus. When we're talking about public mental health, we're mostly referring to promotion, prevention, and recovery. But I want to pause and take some time to explain the bigger picture in which your local public mental health program might be operating. Because as a reporter, it's hard to narrow down those issues to just the realm of public health when so many other issues are at play. And that's largely because our mental health system is far more reactive than it is preventive. And when the insurance parts of the system fail, it puts more strain on the rest of this continuum here. One thing to keep in mind is the massively important role that Medicaid plays. Medicaid covers about a third of all mental health services in the country. And when we're digging into certain populations like kids or people with disabilities, it's even more. I was just speaking with someone the other day about how much of a difference Medicaid expansion made for the mental health system because all of a sudden you had all these people without insurance suddenly have coverage. So it really freed up a lot of funds and resources for community mental health programs to put toward prevention and promotion and recovery. And so if you're here for a story idea, that's one right off the bat. How are the Medicaid work requirements, with millions of people expected to lose their Medicaid coverage next year, going to impact your local community mental health infrastructure? Each state is going to approach their work requirements differently, and people are going to be impacted across the country differently. So this topic really needs strong local coverage. But the other thing I think is really important to be aware of is that the healthcare system and commercial insurance often lets down patients with mental illness. There are long-standing systemic problems with health insurance companies not providing adequate coverage for mental health care. Congress has passed multiple laws aimed at making sure that insurance companies treat mental health and physical health care equally, and yet we know that that has not translated into reality. So that means that the community mental health system is picking up the slack for a larger system that fairly consistently drops the ball. So that, coupled with a chronic workforce shortage across almost every mental health profession, simply means that a lot of people with mental health conditions who need treatment aren't getting it, which puts strain on every other part of this continuum here. So beyond commercial insurance, when we're talking about paying for public mental health, it's really a patchwork of multiple different funding sources. States often use their general funds to pay for a lot of it, and some communities will fund programs themselves as well. But a really big player in that space is a little-known agency called SAMHSA. That's the Substance Abuse and Mental Health Services Administration. It is part of the Department of Health and Human Services, and it's really the primary federal agency for addressing the country's behavioral health. It provides billions of dollars in grants to both states and local organizations. And this is where I think reporters can find a lot of stories and sources and data. So if you are new to this area, I would spend time familiarizing yourself with SAMHSA's website because you can find a lot of information about mental health services and interventions. And you can also find the language that this field uses, which makes it easier for you to then find what's happening in your community. The way I've heard it described to me is that SAMHSA sets the tone for mental health and substance use care across the country. It oversees 988, which is the mental health crisis line. It funds a lot of community-based programs to prevent mental health conditions. And it's on the front lines of responding to the overdose crisis. But like all other federal agencies, SAMHSA has been impacted pretty significantly by the changes that the second Trump administration has brought to the federal government. I put here the changes we've seen at SAMHSA over the past 5 years. In 2021, they had 472 full-time staff, and that grew to nearly 900 in 2025. I've been told that during that time, SAMHSA was really effective in helping to implement 988 and crisis services across the country and in responding to the overdose crisis. But now we know that SAMHSA lost a lot of their staff in the Doge cuts. I don't know exactly how many. It was reported, I think, that they would lose half. And in the administration's 2020 fiscal year proposed budget, they proposed for the second time to eliminate SAMHSA. They want to incorporate it and a few other health agencies into a new administration for a Healthy America, or AHA. And they also propose cutting SAMHSA's budget by, I think, about $750 million. Now, it's hard to know exactly how they would cut SAMHSA's staff, but the budget proposes 297 staff members dedicated to mental health and AHA. So it's vital to remember that this is just a proposal, and Congress has the final say. Last year, they basically ignored this proposal, did not create AHA, and they funded SAMHSA at the similar funding levels that SAMHSA had had the year before. But it's something to keep in mind. I think the environment right now in mental health care is making organizations on the ground nervous and is causing them to act more conservatively. They're not going to take risks on new projects because they're worried that funding will be pulled out from under them. In January, SAMHSA abruptly terminated $2 billion in grants. Then there was a massive response to that, and they changed course the next day and reinstated the grants. We've never gotten an explanation for why that happened or if it could happen again. But it's just adding to this sort of chilling effect that I think you'll see within the mental health community. I spoke with a group in New Orleans that was going to have to cancel their mental health first aid program in the local school system because of that grant termination, because they had to make sure that services they offer to people who are acutely in need are still available no matter what happens with their funding. So they would have had to cancel this program that's focused on increasing mental health literacy and preventing poor mental health outcomes and focus instead on reacting. So it's just another example of how changes like this can just further entrench the mental health system into this pattern of reacting to illness instead of putting resources toward preventing the illness from occurring in the first place. So the money that Congress allocates to the states is to pay for their mental health is funneled through SAMHSA. Those are called the SAMHSA block grants, and they're doled out based on a formula. But they also have a lot of different grants to individual groups that address a wide range of mental health issues. And that's where I think reporters can find a lot of sources and stories. Even with the uncertainty we have in all of public health right now, SAMHSA can still give you a lot of really rich information that can help you dig into your own community or state. So this is the SAMHSA grants dashboard. That's the URL right there at the top. And when you're looking at this grants dashboard, if you select discretionary grants, you can get a sense of what topics are being addressed in your state. Now, this is not comprehensive because remember that funding for mental health programs comes also from the states and nonprofits and local counties, but this can at least get you started following the money and seeing what problems are being addressed. You'll see a lot of repeated grants. For suicide prevention, there's the Garrett Lee Smith Prevention and Early Intervention Grant. That's for kids in school and then college students. You'll see a lot of grants aimed at making sure people with opioid use disorder get access to medications. And you'll see grants related to addressing childhood trauma as well. Now here I used Washington State as an example because I know one of the fellows is doing her project on mental health wraparound services in Washington. So under filters, I selected discretionary. That's important because the Non-discretionary grants are the block grants. And then I can select the state. NOFO stands for Notice of Funding Opportunity. Those are the grants themselves. And you can filter the dashboard based on the NOFO to see what organizations across the country are doing this work. And that may be interesting so you can see what's happening nationally or so you can compare your state with others. Another thing I like about the dashboard is it goes back as far as 2014, which I think is just inherently interesting, right? To find out what was funded before, what has disappeared. Is the need gone or is a need just going unmet? So I kind of walked you through how you can find stories and sources by following the money, but now I want to dig into the data. So the National Survey on Drug Use and Health is run by SAMHSA. This is the country's main epidemiological tool to understand substance use, especially, but it also has some behavioral health measures as well. But it helps steer the country's response to the overdose crisis. I should note that the entire staff that conducts this survey was let go, I believe, in the Doge cuts. It's now run by a third-party contractor, so it's definitely could use more journalists' eyes on this going forward. I didn't include a ton of screenshots from this survey because, in my opinion, it's not super user friendly, but they do assess a lot of different measures though. So it's worth checking out if you're doing something and one of these measures might be relevant to your reporting. They look at specific substances and you can break it down by age. So if, for example, you're working on cannabis use among teens, this could be a great resource for you. The 2024 survey also allows us to look at trends over the past few years for the first time in a while because they updated the questions a few years back. I'm pretty sure the 2025 survey should be coming out sometime soon. I haven't heard any word on it, but the 2024 one was released in July of last year. It does have some challenges, this survey, in my opinion. For the 2024 survey, to get breakdowns by demographics like race or gender, you have to go into each data set individually. They don't make it easy. So I also wanted to direct you to some other data sources that are much more user-friendly and from which I think it's easier to identify new sources. So of course, the best data source might be in your own state. Especially since the opioid epidemic, a lot of states are at the very least tracking substance use metrics on their public health dashboards, but some also look at other mental health metrics like rates of postpartum depression and suicide. And then there are other publicly available data sets that are really easy to use. One that I really like is Mental Health Americas because you can break it down by county, which for local reporters, I remember is very exciting. Another resource I like is the Kaiser Family Foundation's Mental Health and Substance Use Indicators website. This is pulling data from a bunch of other federal surveys. So they do use SAMHSA's National Survey on Drug Use and Health. They also use some metrics from the CDC. And they really rescue us reporters who are not super data savvy because they make it a lot easier to view the data based on demographics like gender and race. So if you're on the hunt for a data-driven public mental health story, I would definitely start there. One thing I would recommend reporters do is investigate how these surveys were done and what measurement tools were used. How many people did they interview? How did they measure if someone had depression, for example? Being skeptical of the methodology forces you to consider something like a survey that maybe you would have taken at face value before. How did they pick who they were going to talk to? What was the demographic breakdown of respondents? Those answers can add more to your understanding of what these numbers tell us, even if it's not something you necessarily need to convey to your reader. And that leads pretty fluidly into something I wanted to talk briefly about, which is covering scientific studies. I know that this isn't necessarily the first topic you think of when you think of public mental health, but I do think that being able to find, read, and translate a scientific study is a really useful skill for all health journalists that I wish I had had earlier in my career. So one of the reasons I wanted to share this information is because it helps, I think, to address something that always comes up when you're covering mental health, and that's the stigma. Stigma is something I have gotten really tired of hearing about as a mental health reporter because you hear it all the time. What a role stigma plays in people's ability to access care and what care is available to them and how policymakers approach mental health. But unfortunately, it is true. Stigma is, I think the pandemic did a lot to address stigma. in the country and in the general public overall, but it's still a very real issue. And covering the research can slowly chip away at any stigma your readers might have because they'll see that mental health conditions are real illnesses that can be significantly improved with treatment, and researchers have the data to prove that. So, researchers themselves are excellent sources. They care a lot about their work and are often eager to share it with the public. They're not the best communicators all the time, so I think that the relationship between a journalist and a researcher can be really helpful for both. I remember the first time I spoke with a researcher for a story I was working on. I was interviewing this veteran who had really severe PTSD, but he was having trouble getting 100% disability from the VA. There was confusion and just a lot of hoops to jump through, and no one was denying his diagnosis, but just the system was not straightforward for him. And I spoke with a researcher from a local university, and it was like talking to an encyclopedia made specifically for the the questions that came up during my reporting. I think she was a law school professor, so she wasn't a health researcher, but she had so much background information to give me because she had spent so much time looking into PTSD and veteran disability. So I really can't recommend enough that you try to speak with a researcher or an analyst or just someone who spends a lot of time being thoughtful about the issues you're working on. It can make a huge difference. Now, getting studies can be tricky because so many of them are behind paywalls. But this is a PubMed search that I did for the Maui wildfires because one of the fellows was reporting on them. Two of the studies are on mental health outcomes after the fires, and they're free. And they're fairly recent. You want to keep your studies at least within the last 2 years. That's my general rule of thumb, because the science changes really fast. But I also did a search for adulthood transitions for people with autism because another fellow was doing her project on that topic. And I found a study that was behind a paywall, but seems really relevant to the work she's doing. And I thought it would be a good example to show you how easy it is to get in touch with these researchers, if only just to ask for a PDF of the study, which they're usually pretty happy to send. Whenever a study is behind a paywall, typically the corresponding author's email is not. So you can see here on the Springer website, you can just click the little email button and you get the researcher's email right away. Sometimes I'll do like a Control F search for the @ symbol so I can just find the email right away in the document. And I mean, that's a little reporting trick, right? If you ever have a professor or a researcher or someone whose email you're trying to find, you can't get it, look to see if they've published any studies. And if they're the corresponding author, chances are you'll get their email right there. And so, yes, final thoughts on covering scientific research. Be skeptical. Don't forget to check the study's limitations because that's where the researchers will be upfront with what their study can't tell you. And make sure you're always checking who provided the funding. Since I don't have time, I wanted to give a shout out to the Open Notebook. They're all about evidence-based reporting. A lot of their resources are free, and they have this great science reporting navigator that can help reporters just sort of understand scientific studies so they can translate that to their readers. I think a big issue in science is how unapproachable it is. Studies are often written in ways that just aren't friendly to a general audience, not to mention the fact that a lot are behind a paywall. So journalists can just play a really important role in helping shine some light in that space. So I wanted to give some final thoughts when it comes to finding sources. But I also want to be cognizant of the fact that many of you may be reporting in small newsrooms where you don't always have time to bite into these big projects that I'm referencing here and that the fellows are reporting on. I would suggest starting small. Chip away at a problem. My first bullet here is about talking to the groups that are providing services on the ground. One thing you can do is just pay attention to any news releases they send out, follow their Facebook, do a small story on an update they have, and then follow up with it later. Do a feature on one of their programs when you do have time. Ask them who else you should be talking to and what else you should be paying attention to, because those relationships are going to help you. And over time, the more you show those sources how much you care about this topic, the more likely it is that they'll reach out to you. My first journalism job was in a small newsroom in the Shenandoah Valley in Virginia, and we had to meet a quota of 10 stories a week. There was a chalkboard in the newsroom with the reporter's name on it and a tally of the number of bylines we have, so it was a pretty old school cutthroat sort of situation. But I developed a really good relationship with the executive director of one of our local free clinics. And over time, by reporting on a few of their stories, by asking her for comment when I was writing about Medicaid expansion, I became the first person she would call with stories. That led to features on local people who were in the Medicaid gap, which is when they make too much to qualify for Medicaid, but too little to qualify for subsidies on the marketplaces. The free clinic was just having a lot of trouble providing the intensive care that some of those people needed, and it made great stories that also thankfully added to my weekly quota. Another thing I want to highlight is how important it is, whenever possible, to talk to people with lived experiences. No individual case is going to tell the story of an entire system or population, but neither you nor your reader will truly understand what is happening or the impact if you don't talk to the people who are living through it. Peers, meaning people who have been through an experience with a mental health or substance use disorder and now coach or help others in similar situations, they're an excellent option when you're writing about mental health condition because not only have they experienced it themselves, but they're also likely comfortable communicating about it because they work with others. So ask those advocacy groups or local organizations, and once you build their trust, they'll be more likely to think of you when they know someone who has a story that needs to be shared. And then, of course, when you are talking to someone with a lived experience, if they don't have much background talking to the media, be really transparent about basic facts like what on the record means, off the record, on background. Make sure they know when they're being quoted. And then, final piece of advice. With every story on mental health and substance use disorders, remember how vulnerable these populations are. Remember how much progress has been made in expanding access to care and prevention, but how much work still has to be done. And remember that reporters can play a really pivotal role in educating the public and speaking up for those who cannot. So, my final slide here has a few story ideas that I jotted down. I know a lot of you are probably always on the hunt for new story ideas, so I will just read those through really quickly. The Medicaid work requirements, end of the ACA subsidies, and the expected rise in uninsured generally. This is, as you can expect, going to have an implication for the entire healthcare system, for the insured, for the uninsured, et cetera. It's also going to mean big changes for your community programs, and I don't want mental health programs to be left out of that conversation as those things start happening. So ask your local programs, like, are they bracing for a greater need for their mental health and substance use disorder services? Crisis care in your state or community since the implementation of 988. 988 is obviously available across the country, but whether or not someone has somewhere to go if they need in-person care after calling 988 isn't always guaranteed. Where do people go who are having a mental health crisis in your community? Is the emergency room their only option? Because that's not a great option for someone going through a mental health crisis. The rise of screen time, AI chatbots, social media use. Check the data in your state or locality on depression, anxiety, and ADHD among youth, and then look into policies around the use of these technologies in schools. See if there's any parental education. Early psychosis care. So, early treatment for psychosis soon after the psychotic symptoms begin can make a world of difference for someone living with a psychotic illness, vastly improving their outcome. Yet many do not receive these services. They're not widely covered by commercial insurance, and many states use their SAMHSA block grants to pay for them. But at the same time, a lot of people just don't know about these illnesses and they don't know about the importance of getting care really early. So, what are the routes for someone in your community to access care for early psychosis? Is there a lot of education around this? Does the program have adequate funding? And then changes in the SAMHSA grants. Some of the newest grants explicitly prohibit some harm reduction programs, which are aimed at reducing risk from illicit drug use, like needle exchanges. And they also prohibit housing first policies. Check in on the organizations in your area and see how they're handling that. And of course, the workforce shortage. How is your community impacted by the chronic mental health workforce shortage that is impacting nearly every mental health profession? So that wraps up my presentation. Thank you all so much. I'm really looking forward to questions. And also, if anyone wants to email me, my email is on my LinkedIn, so feel free to reach out.
Katie, thank you so much. That was very comprehensive, really incredible, and important information there. And I appreciate how Easy you made that to understand for those of us that don't cover mental health and substance abuse on a day-to-day. So thank you. Um,
Yeah.
I just want to reiterate that we will, now open to questions from our audience, and if you have any, please share them in the Q&A function, which should be in the menu at the bottom of your screens. But just to kick us off, I really appreciate that you talk about, speaking with experts, but also speaking to people with lived experience. Depending on what you're covering, I'm curious about what types of conversations you have with sources to help prepare them for interviews, particularly when you're talking to people who may have little media background.
Yeah, I think that a big part of that is making just sort of doing your due diligence and making sure you're being really transparent about what you do. Um, tell them to tell you when something is off the record, to tell you when they want to talk on background. Often they may have information that's really helpful for you to know, but which they don't want to include in a story because it's personal, right? They have their own experiences and that's what you're asking them to share, but they are in charge of what they share with the public and what they don't. So I will often call my source again after I've written the story just to talk them through what I've included to make sure that they are okay. It's a courtesy just because these aren't necessarily sources that I'm trying to hold accountable. They're people's real stories that we're trying to share to help educate the public. So we just want to be good stewards of their stories.
That makes total sense. That makes total sense. It's almost like you have a different approach with someone who maybe is
Yeah,
talking for the first time about something really sensitive versus someone
100%.
media trained,
If I'm talking to a
expert.
lawmaker, my approach, my demeanor going into it's going to be very different than when I'm talking to someone who, is just dealing with the opioid crisis or something like that.
Definitely. David, thanks you for your coverage and is a Marine Vietnam combat veteran for peace. And I'm going to try to get to this question here and sort of apply it in a way that I think might be general and useful for everyone here. David's concerned about the lack of coverage on veteran suicides and wondering, as that problem is intensifying, how can journalists improve coverage of this, expand coverage of this, particularly when it comes to speaking to people in the streets, taking on that responsibility. So curious if you've done any coverage on that or have seen, really good coverage of it or have advice there.
That is such a great point. Is honestly something that everyone here should keep in mind because those are stories that we should be doing. It is something that I have had in the back of my head. Kind of the first thing that comes to mind are rules around access to guns and firearms on bases that I think have recently changed. And it's something that
Mm.
I really want to approach. But yeah, I mean, when you're writing about this, I think a lot of times these kinds of stories can turn into plain data stories, right? Like every year the data comes out on the number of suicides that have occurred, and we report on that, and it's bad. But we can be more proactive in highlighting the preventive strategies that actually work because there are preventive strategies that work. I know the VA has implemented some. I don't know if they're very widely available, but highlighting those success stories can be a way to get at this really, really, really heavy topic while still drawing attention to it without while pointing to a solution because that's something we always want to do. I mean, especially when you're talking about suicide, mental health, and substance use, these are really heavy topics for a lot of people. But there's also a lot of hope. And I think we would be remiss if we just focused on the negatives and didn't point to the positive interventions that we know can work.
That makes a lot of sense. I think I really appreciate that you have a whole slide dedicated to story ideas. I really hope people are paying attention. Of course, we'll share the recording after this, so people, you don't have to jot everything down now. But I'm
Yeah.
curious if there are any, underreported stories that you particularly are interested in or think, really deserve more coverage.
Yeah, so many. So as I was telling you earlier, Elliot, as I was writing that slide, I was like, man, I need to cover some of these stories. My
Hmm.
editor might be watching this and thinking the same thing. But there are so many things to cover. One thing I'm really personally concerned about is the change in the harm reduction rules in these SAMHSA grants. So just to clear, like harm reduction are the strategies that are used to make to improve, not improve. I'm sorry, let me restart. Harm reduction are the strategies that are used to prevent fatal overdoses. So they're syringe exchange programs. So people aren't using dirty syringes when they are injecting drugs. They're fentanyl test strips. They're these programs, they're safe injection sites. Even before the Trump administration took over, these were pretty controversial in the public health sphere. But they were also, there's a lot of really good data to back them up that they save lives. So I'm just really curious about the implications of this, how this is going to be impacted, how people are going to be impacted. I'm nervous that it's not going to be good, but I've spoken with people with opioid use disorders who are simply trying to get by on a day-to-day basis. I remember
Mm.
I spoke with a mother once, and I have this vivid memory of being outside of her tiny home with her three children running around. And she was talking about how she simply cannot handle withdrawal. So she turns to illicit opioids, heroin, because that is her only option because she doesn't have transportation to get to a methadone clinic as often as she had to go. This was a while ago, before when I was still reporting in Richmond. So I know that the rules around access to medications for opioid use disorder have changed, but that's just something I think about a lot, and definitely deserves more local coverage. And then I'll just also add the role that peers can play in mental health and substance use disorder care, I think has changed a lot since I started reporting as well. People were more skeptical of peers and, allowing people with lived experience to work with people who are actively struggling. But there's also a lot of data to back up how useful that can be. So, looking into local peer programs, some states now have certification programs for peers. So, I think that would be a great local story as well.
Absolutely. Well, thank you for sharing also your own reporting experience there. Beatrice says that a friend of theirs went through a personal situation with his daughter who suffered from suicidal ideation and found out that a lot of research on treatment primarily focused on white populations and side effects are not equal across the board. Is this something you've also come across? And can you speak a bit to the issue of disparities in mental health research?
Yeah, absolutely. Back in 2020, when I think the country was reckoning with all of this, science was also reckoning with that. Not all studies were reporting their demographic data in their studies, which I think has mostly changed since then. But yeah, I think it's absolutely something that reporters need to pay a lot of attention to. I know that the Open Notebook has some information about that too. So if you all want to look there for more information on that, um, the it's really important to look at specific populations when it comes to these outcomes. Um, the rate of suicidal ideation among Black youth especially has been increasing while decreasing for I mean it's we're in a crisis right now for sure, but I think if you look at certain populations it's especially really really bad. So that's absolutely something reporters should be paying attention to, and the studies need to back that up as well. So if you're seeing studies that aren't looking at this demographics, hold those researchers accountable, ask them why, and then highlight those researchers and those studies that are actually looking at that demographic data.
That's a really good point. And one of our fellows, actually, Mark, has a related question. Where Mark's from, reporting about suicides is taboo because it might encourage other people on the edge to do it themselves. And sadly, they've noticed that it doesn't always help with prevention. Curious how you think that reporters can maybe hurdle that. I know you were talking about solutions.
Yes. Yeah. Yeah. That is just it's a really good question. And a really important one for reporters to be having to just have these discussions. Because on the one hand, you know, reporting on these things in an irresponsible manner can do a lot of harm. But on the other hand, not raising awareness of these issues could just leave a lot of people voiceless. Um, this is
Mm.
yeah, you're right, Elliot. Solutions-based reporting is going to play a really important role. The SAMHSA has the Garrett Lee Smith grant program, and I've seen studies that show that in communities that have those grants, implemented, there are lower suicide rates compared with others. So that's like a way to sort of address this. But then also, sticking to the rules around this reporting that a lot of advocacy organizations have. I know Mental Health America has suggestions for how to report on suicide. The American Psychiatric Association does too.
Hmm.
And so sticking to that can be really helpful as well. And just asking an editor to have more of an eye on these stories can be really useful, but definitely go into it cautiously with the intention of focusing on solutions and not making it seem as though, there's no hope here in this area.
Definitely. And I just want to add that, we will pull some of these resources you've mentioned together. We always do a, sort of takeaways blog post. And so we'll
Yeah,
make sure that those are linked.
yeah,
It's
that would be
very
great.
helpful. I'm curious if there's, I'm a reporting nerd, so I'm thinking about the craft here, and I'm curious if there's one habit that you do while reporting or a resource. I know you mentioned several resources, but if there's a reporting tip you have that, has consistently made your own mental health coverage stronger, something along the way that you've kind of learned to do, would love to know what that is.
Yeah, when I was a local reporter in Richmond and in the Shenandoah Valley, I was kind of thrown in head first. You know what I mean? Like I think a lot of reporters are because,
Hmm.
we're talking about underfunded mental health system. So is journalism as well. A lot of reporters I think are often feel like they're on their own when they're doing their reporting, and that's definitely how I felt at times. I think the thing that helped me the most when I was going into a situation, like I remember vividly the first time I ever interviewed someone with a serious mental illness, someone with schizoaffective disorder. She was 19. And before I went into that interview, I just did a lot of research about that illness specifically. And I watched videos of people with schizoaffective disorder explaining their disorder. And it really helped prepare me for, well, mostly for the fact that if someone is getting treatment, they're perfectly functioning and easy to talk to. But it also just helps me come in with a understanding already of what she was going through and what issues she had. So I really don't think that we can over prepare for those kinds of interviews and then like lean on our resources, right? If you do have researchers who are in your camp and you're about to go and do a story about some policy that a legislator just, proposed for your state, ask them about the background of it. Just to ask questions and ask for help whenever you can.
Definitely. I'm taking note of that as well. Joshua wants to know if you have any insight into accountability coverage for government mental health services. In New Mexico, for example, they have alternative response units with licensed clinical social workers and behavioral health experts, but they're still seeing an outsized number of 911 calls for mental health crises still end in political violence. Curious if you have any insight into accountability coverage on issues like that.
Oh man, that's a really good question. I think, again, talking to the experts who may not be in your state, but maybe outside of it and can offer some insight, going back to, so this makes me think immediately of 988, right? And like, why aren't people calling 988 instead of calling 911? Um, when did the state advertise 988? And 988 was implemented, I think, in 2022. When did they start advertising that number to the citizens? Do they advertise it regularly? Because I know advertising that 988 is a thing was a really big deal. NAMI, I think, just came out with a survey that found that more people are aware of 988 and that that's what you call when you're having mental health crisis, which is great, but maybe that's not translating there. So those are just my first two initial thoughts. But for something like this, the other thing that comes to mind is don't forget about it. Like if you are
Mm.
doing this reporting and it kind of fizzles out, make a note, put a reminder on your calendar for a year from now and check in on it again because other reporters may have forgotten about it, but you could have more detailed information. Maybe there was a report that was released quietly or something like that. And this is a kind of story that should be followed up on. That's a really good story that hopefully you can dig into.
Absolutely. Sarah wants to know if you have any suggestions for sourcing real people for your stories and how do you make them comfortable using their name?
Yes, so that is a really good question. The first, I think building trust is key here. Showing that you have done reporting on issues like this that's empathetic and nuanced, that you're reliable and that you're fact-based, right? Like I think showing them that you are someone who they can trust with their story is really ideal. But then also getting a an introduction is really helpful. So this is where what I mentioned when, you know, make a good relationship with the executive director of a local program, a local peer program. Show them that you're trustworthy because then they can be a good word for you for someone with a lived experience. But at the same time, what I have found is that the more you write about this, the more you write about mental health in general, even policy or wonky stories, people will come to you because they are really hungry for that kind of coverage and they don't see it all the time. I've had people reach out to me for some of my biggest stories. Just the other day, or the other week, I think, one of my colleagues wrote about a study on cannabis-induced psychosis, and someone commented on the Instagram post I made for that story and said he had that experience. So I reached out to him and he lives in Scotland and I did an interview with him in Scotland and he has schizophrenia, but he's doing really well. But this issue means a lot to him. And so if you find those people who are really passionate about this, those are the ones who are going to be most likely to use their names. But in terms of using their names, going back to what I said earlier, if you're just really empathetic and upfront with them from the beginning, like, I want to share what your story is and how you want to share it. I want to share your truth. That's all you can do as a reporter is share the truth of the person that you're speaking with. So emphasizing that might make them more comfortable, and help them trust that it's not going to be like a gotcha thing. It's not going to be, you're not going to make a mistake. You are going to be on their side to share their experience.
Great advice. One of our fellows wants to know if you've ever interviewed or reported on people with dementia, and if so, what would be the best practices for doing so?
Yeah, I don't think I've ever interviewed someone with dementia, um, personally. But I do think a lot of the same kinds of rules would apply. You need to make sure that they are able to consent to having their story shared. This is a place where that young woman with schizoaffective disorder I spoke to, I interviewed her with her mom there, um, because they were kind of in it together. So maybe including a caretaker in that kind of an interview. I'm not sure the specifics of the situation, but including a caretaker there to kind of help the patient understand what they're talking about, making sure that they understand the situation that they're talking to a reporter could be really helpful with that.
Definitely. And then, this is again more of like a craft question, but one of our fellows is curious if you use social media to report your stories, Instagram, any other platforms. Both. I'm curious about if you use them to, report, but also to share your stories.
Yes. So yeah, the gentleman from Scotland who I just connected with, who is just such a kind person, he reached out to us on Instagram. We have recently started sharing our stories on Instagram. I think it was about last April we started it. And I've started doing videos. I was telling you earlier, Elliot, that I've started reporting through videos, like reels and short form videos. It's been really interesting and really helpful as a reporter because you have to approach the topic in such a different way. And it really forces you to be thoughtful about how you're reporting and how you're communicating with your audience. Um, so yeah, beyond that, I haven't used it much for reporting, like to find sources yet, but I would like to. I do think that there's a lot of opportunity there. I'm really curious about using Reddit to find sources as well. I know I've seen other reporting where that's been done and it's been really interesting and successful. And then yeah, sharing on social. Social is I don't want to say necessary evil because that's I feel like too doom and gloom, but
Mhm.
I am skeptical of social media while I also really appreciate it in a lot of ways. I think it's a great way to reach a general audience. And I think that there are positive ways to engage with it, but stay tuned because we're all learning as we go.
Definitely. Well, speaking of learning as we go, this feels like a good time to plug our training on Thursday here at the National Press Club. I'll just put a link in the chat. We are doing a vertical video and social video training. So if you're a
Yes.
journalist in the area and want to learn those skills, we are happy to share them and looking forward to that. But back to mental health coverage. I'm just curious if there are common interviewing mistakes that reporters make when speaking with people about their mental health, or if you could speak to any mistakes you see, and maybe mistakes is too strong of a word, just like oversight when writing about mental health that people here
Mm.
could learn from.
I mean, yeah, I think that when writing about it, it kind of goes back to those resources we had talked about best practices that, you know, using terms like die by suicide instead of committing suicide. Those kinds of very, I feel like basic things can make a big difference and make sure that your reporting is really open-minded for the experiences of people who have been through this. I don't know about reporting mistakes, but I will just share something that I did once, kind of early to mid-career, which was that I was speaking with a woman whose daughter who was looking after her grandchild. So it was a kinship care situation. And I was talking to her about kinship care in the state. And we were talking about her daughter who had an opioid use disorder, and that's why she wasn't taking care of this woman's granddaughter. And I was trying to be really empathetic and really thoughtful. And I had just, learned a lot about substance use disorders and about the way to frame them and approach them. And I was talking about how, it's such a shame because this is a disease. This is, a disease that people have. And it is like substance use disorders are objectively diseases. But she took a lot of offense to that and was
Mhm.
very upset about seeing it that way. And
Mhm.
we ended up ending the call and we redid the interview later and we said everything right and everything turned out great and she ended up being a great source for me. But the problem I think was that I went into that situation with my own ideas and trying to be very objective and approach it in a very neutral way, but it was not neutral for her. It was a traumatic incident she was going through, that her daughter was doing something that she perceived as, letting down her family and her granddaughter. So I think when you're speaking with people, ask them how they think of it. How do they perceive this illness? How do they perceive the way that, the world reacts to this illness? Um, and just, again, try to approach it with nuance and remembering that especially when you're talking with someone with lived experience, their truth is their truth and that's it. They're
Yeah.
not going to represent the entire, population, but their truth is still valuable.
That's such a good reminder, and knowing that sources aren't just sources, they're people, right? They're not
Yes.
just statistics.
Yes.
Really, really important information and guidance there. Katie, as we're kind of wrapping up here, I just want to offer anyone who hasn't had a chance to ask a question to do so in the Q&A. We're going to kind of get to our final ones here. But you did mention that changes at SAMHSA will likely have an impact directly or indirectly on other community programs, some of them immediate and some down the line. Kind of curious if there are any immediate changes that reporters should be paying attention to. I know you covered this, but just want to kind of get back to it a little bit there.
Yeah. Yeah, so that's a really good question. Obviously, the grants are one of the more immediate ones. The grant termination that happened in January was a big deal. And if it had not been reinstated, would have required even more coverage. But I think the grants are doled out, they're funded by Congress. Congress makes the decision about like the Garrett Lee Smith Act or grant program. And it's just SAMHSA that gives them out. SAMHSA itself is full of really important experts, like expertise. They run technical assistance programs. So they are in charge of making sure that when an evidence-based prevention intervention is implemented, that it's implemented well. So they are the ones who local organizations can lean on to be like, we know that this approach works. How do we get it to work in our population? What advice do you have for us? So I think that is going to be an implication down the line. I mean, again, Congress last year funded SAMHSA at the same levels that they had the year before. So I think Congress is very aware of the importance of their work, but the administration wants to significantly reduce the number of staff there. And it's the staff, I think, who is really valuable and are really doing the work to make sure that when we're seeing these programs implemented across the country, that they're implemented in a way that works. So I think that is something that's going to be more long term. That unfortunately might be harder to see, but hopefully if reporters just have it in the back of their heads, it can help.
Definitely. Final piece of advice, Katie, if you could give every local reporter one piece of advice before they cover their first mental health story, where would you start?
Oh man. Ask for help. Ask for help from anyone and everyone. Ask when you are talking to the executive director of a community program, say, what else do I need to know about this? What do you think our neighbors need to know about this? What are the misconceptions? And then convey that in your story. Ask for help from the researchers. And, mental health is like anything in healthcare. It's kind of its own world. It has its own language. Sometimes it's hard for a reporter to get involved in that. So read about the research and just ask them what things mean. And it also leads to usually some really good quotes that you can use in your stories too.
Definitely. Thank you so much,
Yeah,
Katie. This has gone so much faster
I
than I
know.
thought. Very, very helpful. And thank you to our audience for your thoughtful questions. We'll share a link to the recording soon, so check your emails later today, along with resources shared during the briefing and takeaways, which will appear in our newsletter and on our website. Today's program is part of our Public Health Reporting Fellowship, which is supported by the Common Health Coalition. The fellowship offers training and financial support for mid-career journalists to complete reporting projects focused on the intersection of public health policy and healthcare delivery. And those fellows are here today and working on those projects as we speak. The National Press Club Journalism Institute is proud to produce programs like this at no cost to journalists across the country with the mission of powering strong journalism in the public interest. And if you'd like to support us in that work, we hope you'll consider making a donation today. There's a link in the chat for that. And please spare a few minutes to fill out a survey, tell us how we did today, and help us improve our programming. And Katie, thank you again. Thank you all for joining us. And to the fellows, please stick around and we'll debrief. But thanks everyone. Hope to see you again soon.
Thank you.